It's now my pleasure to introduce Sue Yell from Federation University to bring us up to date with the latest findings from the Community Wellbeing stream. Over to you, Sue.
Thanks, Michael. The Community Wellbeing stream has been tracking community wellbeing and recovery in La Trobe, and our initial focus was on the impact of the Hazelwood mine fire, including the impact on older people. But for the last few years, our research has broadened to look at a range of factors and events impacting community wellbeing. And a lot has happened since 2014. We've had the closure of Hazelwood, we've had Black Summer, smoke, we've had COVID, as well as the creation of the La Trobe Valley Authority, the Health Assembly, the appointment of the Health Advocate, among other significant things to happen in the valley. So we're looking at all of those types of things. We're also supporting the work of the psychological impact stream using surveys and interviews to explore the relation between community wellbeing and individual wellbeing. Our work on community wellbeing includes both subjective and objective aspects. So by that, I mean we're interested both in how the community perceives itself and also what statistics predict about community wellbeing. To understand how the community perceives itself, in 2020, we conducted interviews with 30 community members and stakeholders. And then earlier this year, our research assistant, Larissa Walker, again interviewed 30 people to see if there'd been any changes in community wellbeing since 2020. And we're still looking at those, analysing those findings, those results. We're also monitoring the topics that crop up in local media and social media groups as another lens on what's happening in the community and the issues which cause concern or maybe inspire pride and positivity. The stream's also been working on a community wellbeing barometer, and this is a tool to measure community wellbeing using statistics taken from publicly available data sources like the census and also the type of data that Vic Health collects. It looks at, the barometer that is, looks at things like access to health services, employment figures, rates of voluntary work, crime figures, cost of living measures, and life satisfaction, just to name a few. So this is a graphic that we call the donut graphic, showing what we're looking at in the Community Wellbeing Barometer. We discussed the design of the barometer with our interviewees, and we also conducted a review of other published research that has looked at similar types of tools. So we've chosen 5 key areas that impact on community wellbeing based on what we learnt from the literature and from our interviewees. And these are services and infrastructure in the pale blue, social connections in the yellow segment, environment in the pale green, the economy in the darker green, and health in the darker blue. And we've then broken down each area into a number of sort of related themes and looked for measures that can, so that's where we look for the statistics that can speak to changes in each of these themes over time. Maybe they stay the same, maybe they improve, or maybe they get worse. In November last year, we presented the barometer to key stakeholders, and based on what they told us, we made some adjustments. And we're currently inputting data and analysing the revised results from that. Then we'll use it to map the community's wellbeing and resilience against significant events like Black Summer, like COVID. Now that we've finished collecting all our data, we'll consider what we've learned about the community's wellbeing from all those data sources, the interviews, the barometer results, the media and social media data, and the surveys We hope to gain insights into what makes this community resilient, as well as its areas of vulnerability. We'll also continue to look at impacts on older people and what we can learn from our elders. Age is continuing to be one of the key factors considered in the analysis arising from the other stream areas. So we're kind of, working with other streams to look at those issues. In the coming months, we'll finish analysing our data, write up reports in order to share our work more widely. And we'll share the barometer tool with any interested groups. And we hope to look for further funding to make it usable and accessible to others. And we also hope to continue working with stakeholders in La Trobe and more widely to better understand community wellbeing in a time of rapid change and transition. And that's it from the Community Wellbeing Stream.